Hi everyone, I'm Adarsh, founder and CEO of AyuSync. We are a startup spun out of IIT Bombay. We develop AI and IoT enabled technology for making non-communicable diseases monitoring as easy as using a mobile phone. Just to check, how many of us used Google Map to come to this place? All of us. So already we are seeing data-driven world, right, wherein adoption has been taken for for moving from one place to another, for consuming any content or anything. However, in healthcare it is still not the case, and there is a lot of catch up to be done. And again, I need not mention again the burden of heart and lung diseases. Around 50% of people are dying because of this. And when we look at the main causes, sedentary lifestyle, then unhealthy diets, as well as environmental factors. And already in the last panel, they talked about the doctor to patient ratio. When we look at even specialists like cardiologists, we have around 6,000 cardiologists. Requirement is around 88,000 cardiologists. So we can't directly all of a sudden make new cardiologists, right? And even to give a personal note, I come from a small town in a place called Chikmagalur district. You'll know for coffee and good scenery. So there is a small town there, and my mother was a nurse. So I've grown up in this hospital quarters. So in front of my house, there was a house of a physician, and he was the only physician in the town. So a lot of patients come to his house even at in evening and nights and knock his door even in the midnight. So looking at that, I thought I will never become a doctor. So I became an engineer instead. So what I see is being an engineer, technology can fill this gap. How? We want to bring care to home. We want to enable home monitoring, and health provider also need to be in the loop. If we're able to do that, we'll be able to reduce the burden of cardiac and pulmonary deaths. There are a lot of trends which are happening. After COVID, everyone purchased a pulse oximeter. Everyone purchased a BP machine. Everyone has a BP machine at home. Do you guys check BP now in that BP machine? Is it accurate? Yeah. So we don't know whether it is even accurate or not, right? I'll come to the reason why. The second trend which is happening is the craze about gyms, fitness and everything. It's all good, but there are again drawbacks with that. I'll come to that again. The latest trend is ChatGPT. We are all putting our health data into that, and we are trying to see what is the diagnosis. Again, there are problems with that. So the first part which I mentioned, existing medical devices what we are using at home, there is a process to use it. And directly, let's say, to give an example for a BP machine, we connect the BP machine and we check the reading. It won't give the right result because there is a process for it. We need to maintain at the level of heart. The cuff need to be placed rightly, as well as, let's say, if I have taken a coffee or tea, the reading will be wrong. And that is a problem currently, and that's why we don't use our BP machines currently. Second, which I mentioned, is fitness, craze about fitness, gym and everything. Is fitness equal to health? Yeah, it's a subset of it. So I have my friends who go to gym and they smoke as well, and they say they compensate by doing extra half an hour workout. Will it work? It won't. How many of us have checked our lipid profile in last 6 months? It will be very less. But we check our portfolio investments. We check our insurance and everything. We don't check our health data, right? The third part, we are putting all data in ChatGPT, but we don't know where the data is going. We don't know the security about it, right? And sometimes it is giving correct diagnosis, but there is no full context of the patient. With all this, current care is very reactive and it's completely fragmented. So what is the best way of data-driven care that we can think of? We can think of quality data coming from a quality medical device, and the devices need to be clinically checked. We are having all fancy gadgets currently, and we put in the description about health, fitness, all those things. How many of them are actually validated by a clinic or a doctor? It will be very less. But we are putting all heart rate and everything. If something goes wrong, they will not say they are liable for it. So we need to have very proper clinical validation for all the devices before we claim something about health. Second, and again, the reason is garbage in, garbage out. AI can't give a proper reading or proper insight if the data itself is wrong. And we need context also along with the data when we are doing home monitoring. Let's say if my heartbeat, it shows 120 beats per minute, it doesn't know I'm on the stage, right? So if I know the context, then the data will make sense. And the third point is, if data is correct, then the insight also will be correct. Let's say if we have a diabetes patient, and if the insulin is spiking for a certain kind of food, we can make sure the diet plan is changed. And if all of these are right, then only the actionable intervention can be taken. And this is the ideal system, I think, wherein data can be made useful properly. And we are at IuSync, we are trying to do an attempt of this, wherein we have medical grade devices which are validated and certified by government agencies, and these are designed for home use. So currently, if I tell a patient to record his heart sound or lung sound, he can't do it because there is no way for him to do it, right? We have developed devices which enable someone to check his lung sound, record the lung sound, heart sound, into his 12-lead ECG, and send it to a doctor. And capturing the BP which I mentioned, we have made sure the process is followed. We asked the patient whether he was walking for last 20 minutes, did he take any medication, or did he drink a coffee or tea. If he says no, then only we proceed. So that process we have done with our solution. And again, lifestyle data is also very important. I will not deny that. It will give you a lot of insight about number of steps, calorie burnt, sleep, and everything. So we have also integrated that, but not to claim it is giving a clinical grade accuracy. It is just to make sure we are getting data like steps and these kind of things. And again, AI is there. There are a lot of upsides, a lot of utilities of that. We have added the AI layer to make sure the process of getting these readings are done properly, not to give a diagnosis to the patient. And out of all this, again, I would say doctors are in the middle of it, because without doctor, we can't get the right diagnosis. The process itself will start from doctor diagnosing the patient with the device, and then giving the devices to patient and do the monitoring at home, so that the patient has data when he comes back next time. So this is how it looks like. We have a bunch of devices. Few are novel devices, patent granted devices, which enables us to acquire ECG, BP, SpO2, blood sugar level, as well as other parameters, including variables. And we have our virtual nurse, not to diagnose, just to facilitate the data collection. So like this, step by step, it guides the patient to do the step, and then the data is collected. That was in Marathi. I mean, it can be in any language. And again, as a son or daughter, I care the health of my family. All those dashboard we have in our application. So finally, the end outcome looks something like this. Yeah, so again, that was not the first product that we launched in the market. The first product was a digital smart stethoscope intended for doctors to listen to better sounds and to do better diagnosis. We have deployed more than 11,000 of these devices and helping doctors to do better diagnosis. If you look at the first graph and the second graph, can you see a difference? There is some patchy shade in the second graph, right? This was recorded from a 6-year-old baby who was having abnormal heart disease, like a congenital heart disease. And when you listen to this, it sounds like lupsh dub, lupsh dub. It's a murmur. The first one, it's my heart sound. It sounds like how you listen in movie, lub dub, right? And we already have algorithm predicting the abnormality, giving sensitivity of around 92%, specificity of around 94%. And we have done a pilot study in Kokeleban Hospital, Mumbai. Now we are doing a larger study in Jayadeva Hospital in South and in North in Fortis Hospital. So these are multiple companies using our product to deliver their telemedicine. So that's our device used by a health worker. Data is sent from there to another place. And this is how doctors become happy when they listen to good heart sounds. So almost like a small child, they had a smile when they listen to this sound, right? Because these sound were enhanced. And during COVID, this is how it was used. You can see the mother and the baby. Our device is placed here, and doctor is listening at a distance. Now also pediatricians want to use like this, because babies cry when they see the doctor. So the babies will be in the hand of the parent, and still the doctor can listen to the sounds. So again, we were part of Shark Tank. If you ask, did we receive the money? We didn't, but we were there. We got the offer. Then we were winner in multiple of the things, Innovation Growth Program. In Switzerland, we were winner in a couple of competitions, and we are also received our seed fund from a Japanese VC. I wanted to make sure the VCs I could connect, but they have all left. I'll try to connect later. Yeah, I think some connect I can get through him. Yeah, so I would if you don't take any takeaway from this, please make sure you go and check your blood report very often to stay out of the cardiac deaths. Thank you.